What makes me different than other mainstream dentists is that I actually look at the whole health of the individual. I'll ask questions, I'll try to figure out what's going on, not only in the mouth, but also in the rest of the body. I talk about their history, and then we just pull it all together, and that kind of helps me with the big picture, and that's when I create the necessary treatment plan for them, which really focuses on health, not just fixing a tooth or fix bleeding or anything like that. I am anti-root canals. I am root canal therapy. I am anti-fluoride. I am anti-metals in the mouth, anti-titanium and metal implants. I am but I'm not an anti-person. I try to look at the positives for people and try to figure out what's going to make them healthy and what's going to make them worse. The reason why I'm anti all of those is because that's what we were taught, okay, as individuals, as patients, and as practitioners, that they're all okay. When you really look at it from the big perspective or the whole body's perspective, it's really not good for you. And if it's not good for you, I don't mind sticking out my neck and saying, if it's not good for you, don't do it. It's just plain and simple. I think it's logical. You need to do what's best for your health. You need to ask questions and figure out what's the best option for you. Not every situation is the same. If you have a friend that had a root canal or a friend that had a certain type of filling, does not necessarily mean it's good for you. And that's the whole point. You need to go find practitioners that are in the know and able to make the right decisions and answer the right questions.
Something that I've been seeing lately is people are getting more and more cases of depression, ADHD. And one of the big questions I get asked is there really more of it? Or people just diagnosing more of it? What's happening? And what I do believe is that people are sicker, but it's not just mental health, it's their body. And so when I was in medical school, they told us, we think at this point, we're going to start to see children with type 2 diabetes, and we're going to start to see children with high blood pressure, because that never was something you saw in children. That was for older adults who kind of got sedentary and obese. And, it's not that long ago that we were saying that, and now it's a common occurrence. We see so many children with obesity and high blood pressure and diabetes. Are they ADHD? Are they bipolar? I think they're malnourished.
We're addicted to food. The Journal of Neurology, there's studies that show that sugars and refined flours and create the same type of pathways as addictive drugs. And we're addicted to these foods, and we have no awareness of that.
You have this thing called a neck that attaches your head to your body. And if your body is sick, your brain is going to be sick too. So yes, these kids are obese and they have high blood pressure and they have diabetes and they have all sorts of inflammatory diseases. And you know what? They can't concentrate and they're hyperactive and they have all these other kind of problems too. Because that's what the medicines do. They kind of mask the symptoms. And then you continue doing all the stuff that got you sick. And you know what? Then my medicine's not working anymore. Right? Well, no, you're getting sicker. And so there are some side effects, that it can stunt your growth to be on stimulants. Giving antipsychotic medication to children is something that I really struggle with that idea, because those kind of medications can cause Parkinson's disease. Okay, so you have to really weigh that out, because the longer you're on those medicines, the greater your risk of Parkinson's disease. Well, if you started it at 8, I'm seeing kids in their 20s that have symptoms of Parkinson's. They have shakes, they have tics, they have problems.
Most of the illnesses that the vaccinations have been used for have really been almost wiped out entirely. Diphtheria hardly exists, although whooping cough is still around and flares up every now and then. Polio has been essentially eliminated in the Western world and is only really around in third world countries. So most of the reasons for giving vaccinations have disappeared. There really actually isn't a reason to give a vaccination for most things. And hepatitis B, for example, doesn't need to be given to any child, and it's universally recommended for children. But most children will never be exposed to hepatitis B in their childhood or their adulthood, so there's no need to give it in the first place. So most of the vaccinations, the death rate from the illnesses that the vaccination is being given for, have actually been dropping way before the advent of that vaccination itself.
I hear all the time, but life expectancy is increasing. Well, why is it's not about how long we live, it's the quality of our life. Is the quality of life increasing? Show me that. I'd like to see that. Because I look at our elderly population and I look what's happening. Good luck proving that the quality of our life is getting better. You know, we can just keep people miserable longer. That's what we can do. And we're doing a great job of it.
So if I could live to 100, then technology would be able to keep me going almost as long as I wanted to. But when I really got my passionate interest was when my parents and my aunts and my uncles, that whole generation started getting old and then started getting sick and declining and then eventually started dying off. And I experienced that up close and personal, and I really, really, really didn't like it. I thought that was the most horrible thing that you could possibly go through, especially the way they died. But what's interesting is 100,000 people around the world die from aging every day. And those, to me, are our most valuable assets. I mean, these are the people with the wisdom. They've got the knowledge. They've got the experience. They've got all the networking capabilities. They've got all their friends, and they're able to get things done. They're able to teach the younger generations. They've got this lifetime of accumulated knowledge and experience, and then one day it's all gone. And society really, really suffers from that. People look at old people, at the elderly, and they kind of look at them as throwaways, because I saw this in the hospital when my relatives were dying, especially my parents. And they don't really treat them as even as human beings, where to me, they're the most valuable resource this world has, our society has. And 100,000 a day, it's tragic.
You know, there's been a lot of research on centenarians, people that live 100 plus. And what's interesting about that research is the average centenarian is healthier than the American 75-year-old. Look at the age gap, right? I met this really amazing woman, 102. You know, she had a little sign on her door that said, if I'm sleeping, waking me up, because I need your company more than my sleep. Her mind was right. She was vibrant. You know, the 102-year-old, you know, in Pasadena, California, who's like a wee bowling championship of her living community.
I think that most doctors don't really understand health. Some doctors do. There's a there's a specialty now called anti-aging medicine. And a lot of MDs, other doctors, chiropractors and so forth, are getting into alternative medicine. Integrative medicine is another terminology for it. But on the whole, on average, doctors are the worst people to go to if you want to monitor your health.
Most dental offices are toxic. Now, what level of toxicity? I'm going to tell you is that I don't like going into dental offices because I know that dental offices are not doing things properly. More specifically, it's the chemicals that they use for sterilization, for cleaning instruments, and also for the mercury that they take out. If they don't take precautions, it's all going into the air and people are getting sick. The dentist is getting sick, the people that work there are getting sick, people that never had mercury filling, just going in for a cleaning, are getting sick, okay? They don't know it. It's just slow toxic dose of mercury that's constantly getting into them, and it's just going to ruin us forever. That's why we're the sickest country out there for being the smartest country.
But we have become so disconnected from what we do every day and what a disease, what we're putting in our body in the relationship to disease. I mean, I was at a hospital at an oncology ward, cancer ward. And you know what they had there? A soda machine. So I asked the president of that hospital. You know what I did? I sat down with the president of that hospital and I said, I have to ask you, and I'm sorry if you never hire me to speak for you again, but I have to say that it's incredibly irresponsible of you to have a soda machine in the cancer ward of your hospital. What are you doing? And he didn't have an answer. You know why? Because he wants people to be healthy. He is not a bad person, but he is so disconnected from what people are putting in their bodies in their relationship to disease. They see a disease, they want to treat it. Just treat it. They're not going in to try to fix the whole body from having it again. And that's why we find soda machines and vending machines with candy in cancer wards. That's insanity, right?
Everyone I went to med school with, they did it because they want to heal people, but I don't know how people get stuck into these roles where I mean, I don't know when it's okay to give a 15-year-old kid 5 different psychiatric medications. I don't understand it. But yet that's happened. And so I have to be, yes, I'm a psychiatrist. And there are people in my field who've actually hurt you, and I need you to know this. I just was working with someone last week where I told him this. You know, he's a young man. He's 19. When I met him, he was on 7 different psychiatric medications. He was on 3 mood stabilizers. He was on twice the normal dose of the antipsychotics, so 2 different antipsychotics. And he still was a hyper guy that nobody could contain because it had nothing to do, he didn't have schizophrenia, he didn't have bipolar disease, he had really bad behavior and a very traumatized life. And he has all these different kinds of tics from the medicine. And I had to tell him that this could be permanent, and he was devastated. And he recently acted out and ended up back in the hospital where they gave him an injectable form of the antipsychotic that's going to be in his system for an entire month, and there's nothing I can do about it. And he was just broken. He goes, "Why did they do this?" You know. And so what I'm talking about is you need to start learning different behaviors so you can stay out of the hospital. And so he came in and to see me, and he was in crisis because his eyes were rolled back in his head all the way and he couldn't bring them down, which is a side effect of this antipsychotic. And I can't get it out of his system because it's every 30 days. So now I'm treating these side effects and trying to calm him down and help him through this crisis because of the medication. And then this is when they're using it when they don't really need to.
Yeah. But doctors on the whole are not taught nutrition in school. They're not taught prevention. They're taught how to fix things when they go wrong. They're mechanics. They're simply mechanics, and they don't have time to pay attention to a client that they should. I mean, they should actually use a Chinese system where they get paid to keep people healthy, and they don't get paid when they get sick.
I think if people knew that mercury fillings or amalgam fillings had mercury in them, they wouldn't do it. And if they didn't do it, the dentist is going to have to try a different option. And guess what? There's many options available out there right now. There's white, plastic, composite, resin fillings that are better. The problem is that dentists are doing them, and it's harder to do. And if it's harder to do, they don't want to do it. And then they blame the material instead of blaming the operator or the person that installs them. And when we work faster for whatever reason, because we have more patients, more interference with the insurance companies, or just we're trying to make a living, that's when troubles start to occur. And that's one of the main reasons why mercury fillings should be abolished, is because dentists are doing the wrong type of dentistry. They're doing it haphazardly, and they're not willing to go above and beyond and doing things right in the first place. This is human error, not necessarily patient error or product error.
Because mammogram has been the standard for so long, it's hard for these doctors to change and want to use this wonderful tool, because a lot of young people tell me, how come I haven't heard about this? And it's the way we're educating as we go to the doctors, what the doctors are telling us, what we need. And even television, we were just talking about that, television is telling us what we need. You know, you've seen it with the weather, how they show the storms coming in, they show the eye of the tornadoes, they show so many things, they do night vision with it. But as medical, what they've done is they've actually taken those colors and designated each one of those colors a Celsius temperature. And then when we're looking at the body, I love the way Dr. Melvin describes it. He says you're measuring you against you. So you're looking at both sides of the body and you're comparing those temperatures. And by those temperatures, that's how we can pick up disease and tumors. Inflammation is going to be warmer. Lack of blood flow is going to be colder.